General, I didn't come here today really intending to talk about the vaccine mandate, but Mr. Lamborn talked about it, and I just had a few questions regarding to that, because this pandemic, as we know, has evolved. We've learned several things. We started with a vaccine, then we had a booster. Is it currently the military or DOD stand that the soldiers should have an additional booster, or is just the vaccine and booster adequate at this point?
Well, right now, the vaccination is the requirement. The booster, there's some that recommend it. I'm fully boosted, and but again, that's not the requirement right now.
Okay, well, I'm vaccinated, boosted as well, but we're a different age than a lot of the fighting men and women who we've seen some side effects. We've also learned that the vaccines longevity was not what it was supposed to be, thus all the boosters. We've also learned that prior infection with COVID has been proven protective, and probably more so than even the vaccine. So I guess at this point, one thing I heard you say was that, that the troops need to obey orders. So at this point in the game, we're not wearing masks on airplanes anymore. We're not wearing masks in this hearing room. Dr. Fauci has said we've moved into a new phase. We're transitioning out of the pandemic. So at this point, is it more about protecting the soldiers' health by forcing this vaccine mandate, or is it more about obeying orders and insubordination?
Well, I think we have a policy from the Secretary of Defense that says the troops will be vaccinated, and
whether it's good for them or not.
Well, I'm not a doctor, so I'll defer.
I am.
You are a doctor, so I'll defer to you then. So, what we want to do in the Army is we're in the active duty Army. We're about 98, almost 98% vaccinated,
So anyway, with 4 seconds left, we're 98% vaccinated.
Well,
2% are got to get it to follow orders.
97.4%, right? 97.4% vaccinated on the active
has
Army.
expired.
Right
I think the bottom line is that DOD's opinion is it is still in the best interest of the health of the entire service to have everybody vaccinated. I mean, it's a healthcare conclusion. Yeah. Go ahead. I'm sorry.
That conclusion is not finite yet. The science is evolving. A lot of things
Sure.
have changed.
Yeah.
And if prior infection is better than the vaccine, then why are we forcing someone to get the vaccine?
I could answer that. First of all, you don't know exactly who has been prior infected. Second of all, I would, from a medical standpoint, disagree with you slightly on the conclusion. I don't think it's all. I think it also is not at all clear that prior infection is better than the vaccine. They're still evolving that. But the official position, I'm not arguing the rightness or the wrongness of the model.
But I would also add that we need to look at the age group. Certainly if you're 60 or older.
Sure. There's a lot of things we have to look at. All I'm trying to say is the official position of the Department of Defense through their health folks is this. They're not just doing it for fun. They're doing I'm sorry.
I hope
we got to move on to one other issue.
People that get discharged wrongfully get
and that could well be the case. All I'm saying is that is the policy, and the reason behind that policy. We can argue that conclusion, but that's the reason behind it.